All right, guys, let's get started. So you suckers are stuck with me today because Kristen put me in charge. So now it's a freaking free for all because you got Beeler answering questions. But what I'd like to do first of all, Doug's going to join us and talk about the virtual clinic and kind of how that works, what to expect with that. So we'll take a pause when he signs on if he's not already on. And from my perspective, what I'd really like to do today is I've got a few slides to kind of promote the conversation, but I've got a few agenda points that I wanted to talk about. And I figure just throw questions at me. I think we should have this be a discussion. Everything's so impersonal now. I have multiple people tell me that my camera's on. That's intentional because I don't get to see anyone's faces anymore. So at least you guys get to see my faces and my awesome hand gestures as we talk through some of these things. This is a learning curve for everyone, and I want you guys to know that we in infection prevention have your back. We want to make sure that if we don't have the answers to your questions, that we find them and that we close the loop with you. So don't hesitate to reach out with questions, but with no further ado, I'm going to start working through these slides. So the first thing that I really wanted to talk about was how we think that this virus has spread. And when I mean how we think, I mean like 99.9% of infectious disease doctors. So you guys all know, and I think a lot of the fear related to this virus is that the CDC came out. They're like, we've got this virus that's spreading in China. And since we don't know what the heck is going on, we're going to do maximum precautions. So that's going to be N95s. That's going to be contact. That's going to be eye shields. It's everything. And it's because we don't really know what's going on. But if we were guessing, we would say this is going to be droplet transmitted virus. So what's the difference between these two types of spread of infection? So there's a lot of things that generate aerosol. And what I'm trying to get here is to a nomenclature issue. So anytime you hit a liquid with force, with anything, droplets, small droplets, large droplets are going to be kicked up into the air. Okay, that's an aerosol. So if a doctor or a nurse tells you that such and such procedure, aerosol generating procedure, they're kind of right. But what are we really concerned about in infection prevention? Well, what I'm really concerned about is are there droplet nuclei that are forming? What are droplet nuclei? Droplet nuclei are little itty bitty pieces of water that may harbor infections, okay? They are less than 5 micrometers in diameter. These are just little itty bitty ditzels that are floating through the air and can be carried by air currents across the room. So just the formation of droplet nuclei does not necessarily mean that you need airborne isolation, but it may be formation of droplet nuclei might lend itself to preventative measures that include N95 masks and negative airflow rooms. But it also has to be a specific infection that's able to ride those droplet nuclei in order to infect a human being, okay? So the only infections that have really been proven with strong data to ride in droplet nuclei are tuberculosis, measles, and VZV, maybe. So all other infections, it's just suspected that it could be transmitted by droplet nuclei. So the reason I bring this up is because we're getting a lot of questions about, well, I've got this procedure that's being done on one of my patients, and the doc says that it's aerosol generating. And my response may be, yes, it could be aerosol generating, but do we absolutely know that droplet nuclei are being created? And the answer to almost all of these is no. There's an extremely weak evidence base for a lot of procedures that droplet nuclei could be spread. And the procedures that have the best evidence base, really, when you get into the literature, are bronchoscopy and their intubations, probably with PCR. There are certain surgical procedures and autopsy as well that are probably at high risk. Surgical procedures that use high frequency oscillating devices like saws are potentially risky, but transmission in these cases is very rare in general. So when we start talking about COVID and how COVID is transmitted, why do I think that this is going to be a droplet transmitted infection? Well, we know a lot of things about COVID so far, and we're learning more every day, but we also have its relatives that we've learned about, right? So you guys remember SARS-1, which was in 2002, 2003. That outbreak of infection was initially suspected to be an airborne disease, right? So the CDC says, we don't know what the heck is going on. Everyone needs to be in N95s and negative airflows. Very quickly, hospitals became overwhelmed with this recommendation. And a lot of hospitals, like we're doing right now, backed off to droplet and contact because that's what makes sense for coronaviruses. We know from other coronavirus infections that they are droplet transmitted. So big, floaty droplets that hit the ground after about 3 to 6 feet of travel. These are not the small droplet nuclei that are less than 5 micrometers that kind of stay suspended up in the air. So in SARS, there was a lot of situations where there were massive aerosol procedure outbreaks where people didn't get infected and they were just wearing droplet masks. So very quickly, what we learned kind of after the fact with SARS-1 was that this was probably transmitted by droplet, and all of the concern for N95 transmission was probably overwrought. There are certainly case series in some of these other coronavirus infections that say, well, maybe there is some airborne distribution, or maybe there are some droplet nuclei that might be carrying enough virus to infect a person. And these are really hard to tease apart epidemiologically. And when you actually look deep into them, critics of the case series say, well, we don't know how well your people were wearing their PPE. And actually, when you look deeper into it, it's very common to find that maybe hand hygiene wasn't very good. Maybe they weren't wearing the mask like they should have been. So there's a lot of gaps that may have led them to be infected that weren't the absence of an N95. So in this situation, most of the evidence, I would say right now, and most professional opinion is really leaning towards this being droplet and maybe contact transmitted. So that's why we made the decision with all of our other downtown hospitals to think that this was a safe option for our patients and for our healthcare workers. So the only exception to that is if you have someone where you are blasting their lung parenchyma with fluid or with something high oscillating, then you might actually force the virus into one of those small droplet nuclei. And that's what we think happens with bronchoscopy with intubation. So in scenarios like that, or these aerosol generating procedures, then we need N95s as far as we know, because we might be forcing the virus to travel in a vehicle that it's otherwise not used to traveling in. So there is potentially still a role for N95s, but even that may dry up over time as we learn more about this virus. The main reason I bring this up is to not be super concerned about the fact that you are not walking around 24/7 in an N95. That is probably way overkill. We're recommending surgical masks. I think surgical masks are probably the best evidence so far. CDC, if you watch CDC over time, they started out saying N95s for everyone. But they're very, very gradually loosening as more and more people say this is going to be a droplet transmitted infection. There was just a paper that came out in Annals a few days ago, actually, that there was a large group of healthcare workers that were taking care of SARS-2 patients or COVID patients. And there was a patient that they were just wearing droplet and contact on, and there was a bunch of healthcare workers that were exposed during a bronch, and none of them converted to COVID. As they were watching over time. So I'm not saying it's zero risk for airborne transmission, but it's not something that we need to be freaking out about at this time, in my opinion. So just be cautious. That's what we're talking about behind the scenes. I think we had ID Clinical Conference yesterday as well. There were 66 infectious disease doctors or pharmacists that were on the phone. No one suspected that this was going to be a virus that could be transmitted by small droplet nuclei. And these are people who do this for a living. So I just wanted to bring that up.